Hey, how you doing?
I'm doing okay. It started recording as soon as I got in. I don't know if okay. I paused it because
Okay, good.
okay. We're gonna get started here in just a few minutes. If you guys could please put your names in the chat if you are somebody that is logged in as like iPhone. There is somebody that I just see. It says on here like Gaquino. So if you could just like include like your first name, that would be really helpful as we go ahead and get started here shortly. And I will put that in the chat as well. Okay, got you in there. Thank you to everybody who's putting their names in the chat, especially for those for some of you guys, it already has like your full name on there. But if it's something abbreviated, or maybe it just says like iPhone, or if it's just your last name, um, yeah, that would be super, super helpful. Gonna just wait a few more minutes here. Okay, it's 5 after, so we're gonna go ahead and get started. I was gonna be moderating this, but some something must have come up with who my original presenter was going to be. Not really quite sure, but that's okay. We will, adapt and we'll overcome, and it's going to be a good day. So my name is Lauren Zerniak. I am the training, mental health training team lead here with ViaQuest. This is part of our monthly webinar series. We offer these once a month. They are open for you to for us to for you to join as outsiders of ViaQuest or non-ViaQuest employees. I mean, so that we can provide some continuing education for. Let me see something with a mail. I'm not sure about that. There is the link was sent in Zoom, or the link was sent for Zoom. So I'm not sure, Janet. Maybe you can, if you see him, you can let him know that. But okay, so we offer a different topic every month. And this topic, this month's the topic is going to be understanding schizophrenia. So I'm going to go ahead and share my screen. Okay, so as I said before, this month's topic is understanding schizophrenia. If you are just now popping in, if you could please make sure to please put your name in the chat, especially if it is something that is like iPhone or if it's just the last name, that would be extremely helpful for attendance purposes. All right, and I will remind that again too once we get going here, or I'm sorry, once we reach the end. So our objectives for today are to identify common signs and signals of schizophrenia, to understand the prevalence of schizophrenia, define psychosis, including delusions, hallucinations, and disorganization, understand the treatment options available to people with schizophrenia, and to gain a basic understanding of antipsychotic medications. Okay. So, I'm so sorry. So schizophrenia, this is an extremely complex mental illness. It can be real difficult to distinguish this between other mental health problems, and in order to make a diagnosis, it really takes time to come up with a diagnosis. It creates a number of different challenges in a person's thoughts and feelings and behavior. It is believed to be caused by an imbalance of the brain's natural chemicals, but it can be managed with psychotherapy and medication. So schizophrenia affects less than 1%. And actually, I want to make sure that I am. Okay, good. It affects less than 1%. It's the onset age is different between men and women. It's men, it usually comes on in their late teens to early 20s, whereas women experience it in their late 20s, but they also have a spike potentially during menopause. There's no known single cause for schizophrenia, but it is believed to be the result of a combination of biological factors and psychosocial factors. So despite the depictions of schizophrenia in popular media, schizophrenia is not correlated with violent behaviors. They're actually more likely to be the victims of violence than to act as the perpetrator. They also are more likely to hurt themselves over others. Now, rates of violence among people with schizophrenia increase in the presence of things like a history of childhood abuse, inconsistency with taking meds, a history of violent behavior, substance use disorders, recently being the victim of violence. So before we can really talk about what schizophrenia is, we need to define what this highlighting feature of schizophrenia is, which is psychosis. So can be called psychosis, can be called a psychotic episode, but this is a period of time where someone experiences a loss of contact with reality. They see or hear things that aren't really there, and they develop these strange beliefs and behaviors. They have trouble understanding what's real and what isn't. Okay, so this can happen for many reasons, and it could be caused by substance abuse, or it could be caused by another mental illness. Bipolar disorder, even things like depression can sometimes have like a psychosis component to them. But it's also caused by a variety of it can also be caused by a variety of medical issues like infections and brain injury. Even women who experience postpartum can sometimes experience psychosis. So let's watch this video here that goes into a bit further explanation of what psychosis is. Can you guys hear that okay? Can shake, if you guys can, let me play that again. You guys hear that okay? Let me make sure I'm sharing sound here. There we go.
He's just started college, and is usually friendly and outgoing. But lately,
I'm so sorry.
He's not been feeling himself. When Michael leaves his room, he is convinced that strangers can hear his thoughts and are following him. He feels frightened. When Michael's alone, he is certain that he hears voices telling him that something bad is about to happen. Michael's paranoia is affecting every part of his life, and while his friend Jasmine knows something is wrong, she isn't sure what's happening or what to do. Michael is experiencing psychosis. For most people, it is a scary and confusing experience. It can also be upsetting for those, like Jasmine, who witness a psychotic episode and don't know what is happening or how to help. Understanding psychosis and being able to recognize signs of it is the first step to not being afraid of it. And it lets you reach out and offer help to someone who may be in need. Psychosis is treatable, so getting someone help is the goal. So let's take a closer look. What is psychosis? Psychosis is a set of symptoms that impacts a person's thoughts and behaviors. Psychosis symptoms are different for everyone, but the common experience is losing touch with reality. During a psychotic episode, sufferers can become confused and misinterpret what is going on around them. How long the symptoms last and how intense they are varies from person to person. Psychosis can affect people of all races, ethnicities, ages, genders, and cultures. What are the symptoms of psychosis? Hallucinations are sensory experiences that only exist in the mind. Even though Michael is convinced the voices he's hearing are real, they are actually auditory hallucinations. These are a common symptom of psychosis. Hallucinations might also be visual, which means seeing things that aren't there. People might also smell things and even feel things that no one else can. Another common symptom is delusions. Delusions are firmly held beliefs that seem very real to the person, though they are not real. People can suffer from many different types of delusions. In Michael's case, he has the delusion that people are listening to his thoughts with the intent to harm him. And even though his friend Jasmine tries to explain to him that it can't be real, Michael is certain. Some other delusions people might experience are believing they're superhuman or in touch with a divine force. When understanding whether a person has a delusion, it's important to consider that culture can influence how people express their feelings, thoughts, and emotions. What is an accepted belief in one culture might be considered unusual in another. Disorganized thoughts are another symptom of psychosis. Like Michael, people having a psychotic episode may make up or use words or phrases that don't make sense to anyone else. For Jasmine, Michael's behavior is becoming a little frightening. He seems confused, and sometimes Jasmine struggles to understand his muddled sentences. Even if they appear distressed, Many people with psychosis may not be aware of or recognize their symptoms. Others may feel that their symptoms actually have a positive impact on their lives. But for most, psychosis is a distressing and confusing experience that could be a sign of a serious medical condition. What conditions are associated with psychosis? Symptoms of psychosis are associated with some serious mental illnesses. Schizophrenia typically flattens the emotional expression in people's speech, tone of voice, and body language. Schizophrenia always includes symptoms of psychosis. Bipolar disorder is characterized by unusual and extreme mood swings, which can shift rapidly from high to low and back again. At times, it can include symptoms of psychosis. Major depressive disorder causes persistent feelings of sadness, and it can sometimes include symptoms of psychosis, although it's uncommon. These are not common illnesses, but they are serious, and the first symptoms usually start very late in adolescence or early adulthood. Also, psychosis can sometimes be a side effect of drug and alcohol use or withdrawal. And psychosis can also be triggered by medical conditions, such as a stroke, traumatic brain injury, or brain tumor or cysts. What do you do if someone is experiencing psychosis? Jasmine is very worried about Michael. Though in the past she has tried to convince him that what he is experiencing is not real, she has noticed that that approach is not helpful. She knows now that the delusions and hallucinations are very real to him, so she has learned to be careful. She avoids appearing to dismiss them or even trying to talk him out of them. Instead, Jasmine decides to talk to him about getting help. People with psychosis may not reach out for help because they may not recognize that there is a problem or may worry about being judged. But if symptoms are left unaddressed, people can experience a significant loss of daily activities, poor health, and be a risk to themselves. Jasmine approaches Michael gently, in a caring and non-judgmental manner. She communicates with him in a calm, clear way and encourages him to talk to someone he feels comfortable with, such as his doctor, mental health professional, or someone he trusts. The road to recovery may be long and hard, and it takes work. But with appropriate interventions such as medication, talk therapy, and social supports, psychosis can often be managed, and people can be supported to live full lives. You can also find help by calling, texting, or visiting NYC Well online. And remember, caregivers need emotional support too, and NYC Well can be a resource. Get the help you need. Free, confidential, and available 24 hours a day, 7 days a week.
All right. So, a little bit more introduction there to about psychosis. Looking here at some key symptoms of it, we're going to talk. It's really categorized by two things here. We've got delusions, and that occurs when someone believes ideas that are clearly false. So people are reading their thoughts, or they can control other people's minds. And then there's hallucinations, and this causes a person to hear voices inside or outside of their heads, or less commonly, they see things that do not exist. So we'll talk about delusions and hallucinations in more depth later in just a few slides. So schizophrenia symptoms fall into two categories. We have positive symptoms, and these were not seen when the person was healthy. And in this sense, a positive symptom means that it adds to the person. So before, I'm saying when they were seen when they were healthy. So back when they were healthy, they were not experiencing delusions, hallucinations, disorganized thoughts and mood. But now it's being added to them, right? So the positive means it's being added onto them. And then the negative symptoms is when there is a loss of normal emotional responses or other kinds of thought processes. So lack of energy, change in physical activity level, reduced motivation, sometimes lack or loss of interest in feelings, or lack or less concern for some personal appearances. So delusions will be different for every person, but they tend to fall into these general themes. So there's a focus on being persecuted if they have delusions of persecution. So this is like they're out to get me. The CIA has placed cameras in my house. Delusions of grandeur. So this is like a false belief that there are famous people, that this person is famous, that they have fortune, or maybe that they possess special powers. There's also delusion, like, I know Beyonce, or she's going to get me a record deal. Then there's delusions of reference. So this involves a belief that they are getting special messages through the radio or the television, or that arbitrary events are somehow related to them. So God is speaking to me through the TV. Next, we have delusions of control. So this a person outside of themselves has control over their thoughts and their feelings or their actions. So someone is putting those thoughts in their head. Then we have nihilistic delusions. And nihilistic delusions, this centers around the belief that there's a major catastrophe that's about to occur, like aliens are coming to declare war on us. And then lastly, we have somatic delusions. So this involves a preoccupation with like health or organ function. So being convinced that they have cancer or are pregnant despite multiple tests that are saying otherwise. So many delusions, they will not neatly fall into these categories, but will involve elements from several. Now, hallucinations, this is affecting your five senses. It makes you feel that someone is in the room with you or that is standing behind you, even if you cannot see them. So first we have auditory or sound, visual, we have tactile, gustatory, a fancy way for saying taste. Olfactory is a fancy way for saying smell. And there are also hallucinations that do not affect the traditional five senses, such as the presence of proprioceptive hallucinations. Now, proprioception or proprioceptive hallucinations, it makes you feel as if your body is like flying or floating when it's not. This is similar to how you may still feel in motion when you step off of a boat. So if anybody is familiar with like weighted blankets and how, that kind of tailors to like the proprioceptive input, it's like that deep muscle kind of feeling. So that's proprioceptive. So again, when it's a hallucination we're talking about, it makes you feel like, flying or floating. Whereas auditory hallucinations, they have been found to be the most common form, followed by visual, and then taste is the least common form. So I would like you to pay attention here in the video. I'm going to ask afterwards what hallucinations and delusions did you notice? Now, I'm not expecting you to remember, it's a nihilistic delusion. I'm not asking you to remember that. But if you could just point out the things where you're like, oh, that's definitely like one of those psychosis symptoms that he is that he's presenting with.
You are about to experience a brief simulation of a psychotic episode in a patient with schizophrenia. Schizophrenia can provide powerful experiences, especially for those undiagnosed or not being treated effectively enough. The symptoms you will experience represent a compilation of a range of sensory occurrences as reported by actual patients. These occurrences include sights, sounds, as well as wind and even scents. If you have any discomfort during the experience, please signal a facilitator.
Worthless.
He's waking up now.
Oh, the phone woke him up. Don't answer. They'll know who you are.
You're a waste of space.
Why are you so stupid?
A waste of our time.
Stupid. So stupid. Worthless. We hate you.
He's gonna pick up the phone.
They'll know if you lie.
Rain! It's
Something
rain!
wrong. Weather.
Now to get pizza.
Poison.
Coming for you. Pizza.
He's hanging up.
Do you hear me?
Don't eat. Out to get you.
Poison.
They know about you.
Cameras
Poison.
were rolling when the armed gunmen entered the convenience store on 14th Street. The suspects were described as medium in stature with a slightly youthful demeanor. Anyone with information about this incident is urged to contact
They know.
authorities.
They know about you.
And in other news, officials have closed the northbound
Time for
lane
meds.
of
Don't do
Boulevard
that.
due to a water main break. Repair crews are on the scene. Now here's a story out of Chicago from last night. Two men posing as maintenance workers nearly made it out of the Quick Bite convenience store with the store's ATM machine.
Make a
The
list.
suspects
Make a
pulled up in
longer
van,
list.
entered the store, asked for
You
customers
are
to not use the
ungrateful.
machine because of
You're a
reported
waste of
problems.
space.
They
A
told
waste
the
of our
clerk that They were
time.
going to take the machine back to the
Getting
shop for
coffee
repair.
now.
Don't drink it.
Sensing something
Stupid.
suspicious,
So
the clerk
stupid.
That
called
smells
local
awful.
authorities.
Don't drink that coffee.
When the clerk told the men he had called police, the pair took off and left the machine.
Why are you so worthless?
So, Sky, tell us how this weekend's weather is
Weather.
shaping out.
Something wrong.
You know what, Chuck? There's just no stopping the weekend weather. You hear that, Worthless? Weather's coming to get
Something
you.
wrong. Weather.
And what are you going to do about it, huh?
Something wrong. You have to stop it.
You're just going to sit around with your stupid mouth open and do nothing?
You
Huh?
have to stop it. It's the weather. It's here for us.
Now he has to answer the door.
It's here for us. Do something. Stay in. Stay away from the
No,
door.
stop the weather. Protect us.
You didn't order anything. No. Don't answer. You're stupid to open that door. He has to open the door now.
Here you go.
Don't do it.
You'll be in trouble. Poison.
This is for you.
This is for you. He's working with them. He's part of the plot. This is for you. Shut the door. Shut it. Don't eat it. Poison. You're stupid to open. I hate you. We
Here are
hate
some
you.
items on today's activities calendar. And you need some activities, especially when you're lazy and you sleep too much. Stop staring at me.
I know what you're thinking.
He knows. You can stop
They're
it.
coming for you. You know that.
Part of the plot. Use your mind.
It's because you're so ungrateful.
Don't eat it. Poison.
No. Don't open
He
it.
has to open the box.
This is entirely your fault.
Don't eat it. Don't eat it. Poison. Poison.
They're here, and it's all your fault.
Oh.
No.
They know it's you. You're in
Don't
control.
open the door.
You hear that?
No. Don't open it. Don't open it.
They're here, and it's all your fault.
You did it.
You should have used your mind to stop it.
Stop it. You have to take control.
Stop the door.
Hey, you all right in here? I called you. Why didn't you answer? I was like screaming, "It's Lorraine! It's Lorraine!" into the phone at the top of my lungs.
What were you watching? Do you even remember?
Did the pizza Oh, what happened here? Did you forget to take your medicine this morning? Well, you know it's not good to miss a dose. Well, it's not too late to take it now. Let's get back on track. And why are you standing here in the dark? It's a beautiful day outside. Let some sunlight in. You need to get outside and enjoy it.
This experience is intended to heighten your awareness of the conditions affecting breakthrough symptoms in patients with schizophrenia, who may be in need of efficacious treatments. It is not meant to suggest that all of the symptoms depicted here are displayed by all patients with schizophrenia. there is no typical case of schizophrenia.
Okay. So I know initially I said that we would kind of talk about it. If you want to just throw in the chat, and I can check here shortly after we get through a few slides. I want to make sure we've got a lot of like really good content to get to. And so I want to make sure that that we're getting to that today too. So looking here, moving on to disorganized. So when we talk about that, this is like incoherent or illogical thoughts and behaviors that really affect the person's ability to live a healthy and normal life. There's thoughts, behaviors, moods. This is going to be things like disorganized speech. It could be like loose associations. It could be like they are talking about one thing, but they get like really off task, or they start talking in like a big circle where, you know, it's kind of like you took the scenic route to get to the point when talking about this conversation. And then there's like clanging. So this is when a person's word choice isn't connected with any meaning, but it's done by sound. So they kind of speak in rhymes or alliterations, like here comes a cat with a catch and a rat match. So there's just no sense in it. It's all disorganized. On here, I'm just going to mention like word salad. So word salad, it's also called aphasia. And this may or may not follow usual grammar. The word choices may seem totally random, or they have some slight connection with the context. So an example of word salad may be like trees, summer, green, eye, gardening. Water, hard, summer, sunset. So in this example, the words are all vaguely related to one another, but some people may use totally random words. Then there's like disorganized behavior. It looks different from person to person, but it's very noticeable behaviors like walking in the middle of the road or talking to oneself. It can also be more subtle though, like being preoccupied with internal stimuli to the point where they're just not responsive when they're spoken to, or they show some catatonic behavior where they're almost like mannequin-like and in their unresponsiveness. So looking into understanding and recognizing that someone with schizophrenia, they may not believe that they are sick. They may not seek help on their own. And they may also need medication for other mental health help. They may refuse it initially, or they may stop treatment. They could be needing to be assessed or hospitalized or treated involuntarily, like being treated against their will. And people with schizophrenia sometimes lack insight into their illness. So this is something that's really hard, and it's an uphill battle for them and for the people who work with them and the people who love them. So like we talked before, it's hard to tell if it's schizophrenia kind of off the bat. It's not everyone who has a psychotic episode is going to be diagnosed with schizophrenia. They need to be experiencing that psychotic episode on a regular basis. In all other medical causes, like a brain injury, an infection, a urinary tract infection can cause a person to have delusions. And any substances, that all needs to be ruled out. Additionally, any other mental illness that have psychosis as a possible symptom, that should be considered too. Things like schizoaffective disorder or bipolar disorder. There's some medical causes that can, medical conditions that cause it. I talked before just now about mental or urinary tract infection with confusion and agitation. Traumatic brain injury, like they may have severe mood changes, confusion, or some unusual behavior. And strokes, this may cause people to experience irritability and behave in impulsive ways. And then drug use and withdrawal can also cause hallucinations and delusions. A person, schizophrenia has been described as many illnesses masquerading as one, and every person is affected differently. So different symptoms, severity, responses to treatment, even the timing of symptoms and the problems coming and going at different intervals. This is not a constant state. So psychosis occurs in episodes. It ebbs and it flows over time. The person will experience a buildup to a psychotic episode, and this is called the prodromal phase. I'm not going to read this bullet for bullet, but in the prodromal phase, you can see here that they may experience a loss or a lack of interest in some usual activities. They may be withdrawn from friends and family, some confusion. I just said I wasn't going to read it all, and here I am reading it. So you get the point here. Then comes when they enter the active phase or the psychotic episode, they will experience all of their prodromal symptoms plus these other things, such as a continuation of the of beginning on some delusions and some hallucinations. So some distortions in thinking, perhaps some disturbances in their behaviors and their feelings. And then after the psychotic episode has concluded, they enter into this residual phase, which can present similarly to the prodromal phase, right? Withdrawal, trouble concentrating, some things of that nature. So each person's journey with schizophrenia is unique, and it acquires over time. So some only experience one episode in their lifetime, and others experience a lot of episodes. And some experience long periods of wellness between psychotic episodes, and others may experience psychotic episodes that last a long time. Some people may experience a psychotic episode without warning, and others may experience early warning signs. And this is what makes it so hard to treat, because it looks so different for every person. So what does that treatment look like? This all plays on with each other, right? First, we could look at that psychiatric treatment. They may need medication, some hospital-based care to potentially get them, stabilized on med, following up with a psychiatrist for potentially long terms. They may also need some social supports, they usually always need some social supports, some housing, income, employment supports. And then that also all ties into the community services. What's available to them? Is there counseling? Is there some community-based mental health care services like TBS and those programs? Maybe there's even some peer support programs. So let's go on and have a little bit of discussion here. I would like to hear from you guys. You can either put it in the chat, but I really, really love when people turn their mics off and just, have some dialogue too. But now that you've learned a little bit more about schizophrenia, have you guys ever experienced working with people with schizophrenia or any other psychotic disorders? Maybe it's somebody in your personal life, which you don't have to disclose if it's somebody in your personal life. But, what is your guys' background and experience in working with somebody with schizophrenia? And you guys can, like I said, turn off your mics, or you can put it in the chat. You can also just say, I haven't had any experience. That's totally fine too. Okay. Doesn't quite appear that there is, much experience, and that's okay. That every encounter is different. For that person that just typed in, your screen name on here is iPhone 250. Just a reminder about if you can put your name in the chat too, I would super greatly appreciate it. But yes, And so in that case, I'm glad that you're here. I'm glad that you guys are, get to gather this information for this monthly webinar, and we'll continue here talking about treating schizophrenia. Recovery is possible. It's generally considered a chronic condition, so there is no cure. But people can learn to manage their symptoms to the degree that they can lead full and meaningful lives. So some key goals for of schizophrenia treatment: we want to achieve and maintain remission from symptoms, some functional recovery, really improve quality of life, prevent relapse, and prevent progression of the disease as well. So people with schizophrenia, where they're treated, sometimes it depends on where they are at in their experiencing of the symptoms, and what phase they're in, the stage of the disease that they're in. So if it's in that first episode, or if they're experiencing that very first episode, that usually requires a hospital admission in order to figure out what's going on. Again, remember, we talked about wanting to make sure that there's no other medical conditions going on that are causing it. And so usually a hospital admission is where we can start to rule those things out. For stabilization, it could take place in all of these settings. Could be in the hospital, an outpatient psychiatry clinic, or maybe just with their primary care. And then relapses, when and if they occur, would also be handled with a hospital admission, and it could also be managed with that outpatient psychiatry clinic as well. So it takes a team effort, though, right? Like, this is one of the really hard things about someone who is suffering with schizophrenia, is that you need a lot of support, and unfortunately, that's not everybody is blessed with that many supports. So some possible members of the treatment team for a person with schizophrenia: natural supports could be their friends, their family, maybe a support group. Some paid supports could be their primary care provider, like a family doctor or a nurse practitioner. Could be a psychiatrist, a TBS worker, social worker, or even a pharmacist, right? Sometimes it's the pharmacist, especially if you're getting medications through, different providers. And if they're all not, you don't have your by chart all synced up with everything and they all can't see each other. Sometimes it's that pharmacist that catches things, that goes, oh man, this is being prescribed, and this is being prescribed. So, that's not good. Those, interact with one another. So it really takes a large support group, and, support looks different for everybody. The importance of, it's important for healthy living for people with schizophrenia. So really regular exercise, at least 3 times a week. This can make somebody feel more energetic and relaxed. It improves mood and outlook. It can reduce stress. It can also just be a natural way to meet people and help prevent other health problems like obesity and heart rate. Proper nutrition is also essential for the well-being of a person with schizophrenia. Looking here at medications, these are called antipsychotics. Now, there's no such thing as a miracle pill that helps all patients, right? The effects of the medication vary greatly from person to person. Finding the right treatment for each person is usually a trial and error process. And again, that's something that's also very, very hard for people too, because, maybe they don't like the way it makes them feel. And if that's their first experience with, taking antipsychotic medications, then maybe they are, not so keen to trying other things to get that right fit. And so they're not med compliant, or maybe they just, they try one and they're like, no, I don't like this, and they don't want to try anything else. So this often requires extensive support with keeping track of their medications as well. As you can remember from the video that we watched, like the voice in the auditory hallucination the guy was having was telling him that his medication was poisoning him, or that people were trying to, come after him. So again, when you are, dealing with that, that's hard to, sometimes overcome to, take those medications and decipher, hey, what's the legitimacy of that? So we need to have realistic expectations for treating schizophrenia with antipsychotics. Most antipsychotic medications produce substantial improvement in about 2/3 of people who have a psychotic episode. One of these, about half experience a full remission of symptoms, and the other half experience substantial improvements, but some symptoms are still present even though they faithfully take their meds. And unfortunately, the remaining third, they fail to respond to a particular medicine. So in this case, the physician will try different antipsychotics. Many people in this group will successfully respond to a subsequent medication, even if that first one didn't work. Now, taking, I just talked about some of these here too, about how, half will experience a full remission, and how, out of every 10 people with schizophrenia treated with antipsychotic medication, how many receive that substantial improvement, right? The 6 or 7, 3 or 4 needing to respond to different medications, and half of them experience a full remission of symptoms. So we've learned all about these, the things of schizophrenia, all these ins and outs of schizophrenia. But what do you do now? We understand how where it originates and how it functions and how it presents. But what does that mean for you, right? What's the takeaway that you guys have for attending today? And so here are some things to a list of do's for responding to a crisis situation. Remaining as calm as you possibly can. If your behavior and presentation escalate, the other person's behavior and presentation is also going to escalate. If you remember from that video, the person, was getting messages through the TV, and other things like that. And so try to decrease distractions to the best of your ability. Definitely asking people to leave the room who don't need to be there, respecting that, this is a person who is struggling, who is really going through something. And so, this isn't, a show to be watched. This is somebody who needs compassion and our support. And so if you don't need to be there, help usher out the people who don't need to be there. Making sure you're speaking one at a time. Again, if they're having some auditory hallucinations or people talking to them, things can get all jumbled up if more than one of you are speaking at a time. That may be hard to differentiate between that and the auditory hallucinations. Try saying things like, let's sit down and talk, let's sit down and be quiet. Make sure you're speaking slowly and clearly in a normal voice. Make statements about the behavior that you are observing. Avoid patronizing and authoritative statements like, you need to sit down, things like that. That's very authoritative. That's very commanding, and it's just not going to get you anywhere. Repeat questions or statements when necessary. Remember, they're in this heightened state, even just functioning, from like a fight or flight kind of standpoint. They are thinking clearly even from that. And so now we're going to tack on, the psychosis symptoms on top of that. Allow them to have personal space, allow the person to have some personal space as long as it's safe for them to do so. And understand that too much emotion on your part can then further upset them. and affirm or agree with the emotions the person is experiencing without agreeing to the contents of the hallucination or the delusion. Because here's the thing, if somebody were to tell me that there are spiders crawling on the wall, that is not my reality. And that may not be anybody else's reality who's in the room with me. But for that person, that is very real. And that's like trying to tell me that water is not wet, or that, grass is not green, or that rain doesn't come from clouds. In my reality, as is most people's, that is the case. But for them, we have to recognize how scary must that feel if there really were spiders all crawling on the wall. Or if you really did think somebody was trying to do harm to you or poison you, that would be incredibly distressing. And so really coming at that from a place of empathy and realizing, hey, nobody is having fun here. And this isn't something that they are, doing to you or that they are electing. This is something that they're experiencing and something that they're struggling with. Avoid shouting and criticizing. Don't challenge the person into acting out. Avoid continuous eye contact. Don't block the doorways. That's not safe for them. That's also not safe for you. Don't try to rush the person. Remember, this process takes time. And don't argue with other people about what to do. So in summary here, we talk schizophrenia is a serious illness, and this needs to be acknowledged and accepted. The way that the disease affects people is different for everybody. So just because, one person with schizophrenia, that just means, one person with schizophrenia. That doesn't mean, all about it. You know how it affects that one person. These people also lack insight into their own disease and their health. And so that means treating them and getting them to remain consistent with treatment, remain consistent with medication. That is hard. But with proper treatment and support, many people with this disease can achieve a good quality of life, and they can be productive members of family, and they can be productive members of society. And speaking to the family, a huge part of, working with somebody with schizophrenia is working with their family, is really firming up the supports, because it is so common for them to relapse and not take their medication. And who is there to, help guide them along when when this kind of thing has happened. So we are coming to the end here. Here is some references if you would like to educate yourself more about schizophrenia. I'm open to some questions. If you have not already, then, I'm just seeing here in the chat. 10 years ago, when I started my healthcare career, I worked as a DSP in a group home with 6 men with schizophrenia and other various illnesses, and it was very tense home. But I am grateful for the experience because it means so much, because I think it taught me so much patience, or people in general. These men looked normal, which that thought taught me that, you truly don't know what people are dealing with just from looking at them. Also helps with communicate with people during a moment, meeting them at their level and their emotions, and allowing them that space and validation for their moment of fear. Yes, absolutely. I'm seeing some other ones come in here. Thank you, Michael, for verifying that person. Working in a behavioral mental health facility, working with them daily, residents with schizophrenia. Yeah, absolutely. If I will hang out and answer any questions that anybody may have. I am going to stop sharing though. Other than that, if you have entered your name into the chat and you would, that is the conclusion of our presentation on schizophrenia.